Hello guys, my name is Kaustuv Sadbude and we are going to learn antiamoebics today. Antiamoebics. What is meant by amoebiasis? Amoebiasis is caused by causative agent Entamoeba histolytica, and we will show the image on the slide. Antiamoebics. Drug act against Entamoeba histolytica. Poor environmental sanitation and low socio-economic status spreads the disease. This occurs mainly due to fetal contamination of food and water. Let's see the pathophysiology. Feces contaminated with Entamoeba histolytica are first travel in the intestinal lumen, then it either convert into cyst or it can invade intestinal mucosa and form ulcers. By these ulcers, the dysentery also occur. In stools, blood and mucus is present. From invading mucosa, that is by forming ulcers, it can move in nearby blood vessels and then it can go in liver via portal circulation and form liver abscesses, that is hepatic abscesses. This is a diagrammatic form of pathophysiology. Human ingests infective cyst, then it goes in intestine. It actually go in either incystate itself or it can convert into trophozoid and invade the mucosa, and then via portal circulation it can affect liver and form hepatic abscess. Cysts are infective and they can survive even outside the human body. They can transfer to trophozoids. Trophozoids are non-infective. They can reproduce and feed on intestinal bacteria and may cause ulcers. People with high risk amoebiasis. Then people who travel with location with poor sanitization and people with compromised immune system like AIDS patient or patient taking corticosteroids and other health condition also. Sign and symptom of amoebiasis. Most people with amoebiasis won't experience significant symptoms, but symptoms appear after 1 to 4 weeks after ingestion. So here incubation period of amoebiasis is large. These include mild and severe symptoms. Mild symptoms may include abdominal cramp, diarrhea, fatigue, excessive gas, bowel movement with rectal pain, and weight loss. Severe symptoms may include abdominal tenderness, bloody stools, even passage of 10 to 20 stools per day. This is very large amount. Also fever and vomiting also present. Entamoeba histolytica can occur in both intestinal and in tissue of intestine or tissue of liver. So we give two different drugs. One is tissue amoebicidal and another is luminal amoebicidal. Classification of antiamoebic drugs. First is tissue amoebicidal, second is luminal amoebicidal. In tissue amoebicidal, both intestine and extra-intestine amoebiasis. First group of drugs is nitroimidazole. Examples metronidazole, tindazole, secondazole, ornidazole. And second group is alkaloid. Examples imitin, dihydroimitin. And for extra-intestinal amoebiasis, chloroquine is the drug. And luminal amoebicide, there are three group of drugs. First is amide, 8-hydroxyquinolines, and antibiotic. Amide include diloxazine, fumarate, nitazoxanide. Metronidazole is a typical group of nitroimidazole group of drugs. It's a broad spectrum cidal activity against all type of protozoal infections. It's selectively toxic to only anaerobic, as the nitro group present in metronidazole is converted into nitro radical which damage the DNA. Metronidazole pharmacokinetic is completely absorbed in small intestine, distributed widely. Therapeutic concentration present in vaginal secretion, semen, CSF. It can metabolize in liver by oxidation and glucuronide conjugation. So what are its contraindication? It can't be used in neurological diseases, chronic alcoholism. Adverse effect, there are much more adverse effect are present. Some are most common, some are rare. So most common include anorexia, nausea, metallic taste, abdominal cramps, and stool looseness. On prolonged use, peripheral neuropathy seen. Interaction, doses, and uses. So what are its interactions? It's alcohol intolerance and give disulfiram like reaction. Also it induce the enzyme, so drug uh, degrade easily and its therapeutic effect reduces. Simetin reduces metronidazole metabolism. Also, what are the uses? First is amoebiasis. It is a drug of choice for amoebiasis. Secondly, giardiasis. It is highly effective in giardiasis treatment. And for trichomonas vaginitis, metronidazole is a drug of choice. And it can given in prophylactic after pelvic surgeries like anaerobic bacterial infection. And lastly, ulcerative gingivitis and peptic ulcer. Tinidazole. It is same like metronidazole except some character are different, like it has slower metabolism, longer duration of action, better tolerated drug, and some side effects are less like metallic taste, nausea, rash. Uses are same like metronidazole, amoebiasis, trichomonasis, and giardiasis, anaerobic infection, and H. pylori infection. In H. pylori infection, cap therapy is present, two proton pump inhibitor and one antiamoebic like metronidazole. 8 hydroxyquinolones, usually mostly used in PAS. Ability to kill mostly protozoal parasite. Least absorbed and safe drug is diiodohydroxine. Uses non-specific diarrhea, traveler's diarrhea. Side effect, nausea, loose and green stools. Iodism, it refers to inflammation of mucous membrane which due to chronic overload. These 8 hydroxyquinolones are banned in India for children and also prolonged use is banned. So let's discuss some MCQ. Which of the following is used to treat amoebic dysentery earlier? Brazil root and Syphilis ipecacuah both. Imitin is dash dash. Imitin is alkaloid. Which is the possible mechanism of action of metronidazole? It is cytotoxic derived as it convert nitro group into nitro radical, which is cytotoxic. Metronidazole dash dash. It increases warfarin action. Which of the following is not true about metronidazole? So metronidazole is a prototype, yes. It kills trophozoites, yes. Effective against Giardia lamblia, yes. But it only kill anaerobic bacteria, not kill aerobic bacteria. So thank you guys.